There's some fascinating developments today in psychotherapy, in psychology, contemporary psychology. These developments have to do with what's called cognitive behavioral therapy, or CBT. And CBT is closely related to what is also called mindfulness. And there's a development within cognitive behavioral therapy, or CBT, which is called ACT, which represents also an abbreviation, ACT. ACT stands for ACT, and ACT indicates acceptance, commitment, therapy. It also means act, meaning do it. Well, there are fascinating developments in this psychotherapy, which it's amazing how closely they coincide with classical moral philosophy, especially of the Aristotelian Thomistic kind. There's a tremendous convergence between the two. However, many of those who are doing the research in both the therapy and in the neuroscience related to psychology, and these developments in psychology, are not practiced or experts in classical moral philosophy and don't fully appreciate the depth of actually what they're doing in their discoveries. Likewise, there's a need too for philosophers to be more aware of these developments within psychology. Now, to exemplify all of these issues that are really at stake and are being developed right now, I think it could be helpful to consider an example from sports. Sports includes many moments when a lot depends on very little. And that lot isn't just physical strength, but it depends on psychology. It depends upon one keeping one's cool and not choking at a moment of great tension in the sporting event. For instance, a place kicker in football, the field goal kicker in the NFL, for instance. Imagine the Super Bowl, and your team is losing by 2 points, and there's 4 seconds on the clock, and you're on the 20-yard line, and it's your chance for your field goal kicker to win the game with the kick. He's been sitting on the bench, and he's probably cold, although he's been trying to keep warmed up just for this occasion. And of course, he has a lot going in his mind. He hears the cheers of the crowd. He also hears the boos from the adversary fans. And he realizes how much depends on this moment, and he has to get his foot just at the right part of the ball to get it through the uprights. That's the moment when, if he's stressed out, if he experiences some kind of exaggerated fear or anxiety, he could choke. He needs to keep his mind set on the right focus point. Now, this is exactly what contemporary psychology deals with, the kind of perfection of our own thought patterns that are most conducive to proper behavioral patterns, which of course is also exactly what moral philosophy is interested in, thought patterns and behavioral patterns. In particular, Aristotelian moral philosophy is interested in behavioral patterns that are virtuous and therefore constitutive of a happy life. In fact, what Aristotle really set out to do in his treatise on ethics, the Nicomachean Ethics, was to present a plan, a strategy, so that we might be good, that we might be perfect, so that we might be fulfilled, that we might be happy. Now, the contemporary behavioral therapy that is most in development today is inspired by a philosophical strategy which many of its proponents, or those who step back and think philosophically about what they're doing in psychological research, say that its philosophical reference point is Stoicism, and that its religious reference point is Buddhism. The reason why they refer to Stoicism and to Buddhism is because they understand cognitive behavioral therapy as addressing disordered passions, also undesired desires, and reconfiguring them in such a way that you can avoid depression, anxiety, and OCD, obsessive compulsive disorder. Stoicism is a reference point for them, in part because Stoic philosophy is experiencing a kind of renewal today in universities, but also because the Stoics were focused on controlling the emotions, controlling the passions, modulating the passions. In particular, the Stoics were interested in achieving a kind of indifference such that it wouldn't really matter how much one was suffering, that one could still be at ease and achieve a kind of indifferent or apathetic happiness. It's interesting that in contrast, Aristotle had a very different understanding of the emotions. Aristotle understood the emotions, the passions, feelings, desires, even non-rational desires, as being components of our humanity that are calling out to be ordered by reason. We know that for Aristotle, the soul informs the body. The soul informs the passions. It informs the emotions, such that, in a sense, the more the soul is there, the more reason can direct all of our feelings. Well, there's another component of mainstream contemporary psychotherapy, which is its reference point, as religious reference point, as I mentioned, is Buddhism. This is because the Buddhist religious practice entails a meditative practice or exercise in order to calm the emotions, in order to be at peace with oneself and with the world, in order to center upon oneself. But here again, it's interesting to notice a difference with Aristotle, that Aristotle's idea of ordering the passions wasn't simply to calm them, but it was to order them towards the good through rational behavior, ordering them towards that which we live for. So what I'll be proposing in this lecture is that if we were to look at Aristotle and St. Thomas Aquinas and the whole Christian tradition, we could appreciate even more deeply these developments in contemporary psychotherapy. Moreover, the contemporary psychotherapy can add a deeper, not exactly deeper consideration, but it can add considerations that are illuminating for our philosophy. It helps us to explain better what is going on when we're practicing and developing the virtues. Well, Aristotle at the beginning of the Nicomachean Ethics talks about an archer who has an arrow and has bows. He has a bow that he's going to shoot arrows at a target. And he says what we need to do is to aim well, to aim at the target and to direct our whole life like that arrow in the bow at the target. So this directing one's life towards the target for Aristotle is all about ordering our desires, our passions, our emotions towards a good. And this is, I mentioned that ACT, or ACT, Cognitive Behavioral Therapy, talks about acceptance, the acceptance of non-desired desires, the acceptance of emotions that we have that we don't necessarily want to have, and we may precisely want not to have, and yet we accept them. And then commitment, renew our commitment. And this is what Aristotle considers ordering our lives towards the good. Practicing mindfulness, which is putting our mind into what we're doing and seeking the good for which we're living. Now, in the history of psychology, prior to these recent developments in cognitive behavioral therapy, Freudian psychoanalysis was dominant in psychotherapy. But Freudian psychoanalysis is a whole different philosophical milieu. And the scholars who have analyzed psychotherapy from a philosophical perspective compare Freudian psychoanalysis to Plato's Socrates. And for Plato, morality, ethics, being a good person, constituted in knowing what's good and bad. And once you know it, Plato thought you would do it. So it was all about coming to understand. In fact, psychoanalysis is a whole lot about coming to understand through the therapy that includes a dialogue with one's therapist. And that dialogue with one's therapist is also dialogue that then can continue in other moments throughout one's life, throughout the day, in which one tries to come to understand, for instance, what are the causes for the feelings that I'm having? However, what CBT, Cognitive Behavioral Therapy, tells us today is that emotions aren't really necessarily a problem, and they're not really something that needs to be understood. What they need to be is ordered. They need to be directed towards some good. In fact, cognitive behavioral therapy has demonstrated how sometimes psychoanalysis has led to an increase in what's called rumination, that someone thinks more and more about oneself and about what one's feeling, that simply leads to an augmentation, an increase, an intensification of disordered passion. In contrast, ACT proposes that you stare in the face, in a sense, the emotion or the passion or the desire that you're experiencing. You acknowledge it, not in order to wallow in it, but rather not in order to understand it, but to acknowledge it. This is happening, and I can deal with it. It's not going to kill me. And then you renew your commitment, and then you just do what you should do at that moment. And this is the ACT version of CBT. All of this is a proposal to struggle towards virtue, understood in the Aristotelian sense. When I say it's a struggle to strive towards virtue, is that psychotherapy proposes a means for people to order their passions, their disordered passions, and they may be pathological or they may simply be ordinary people who are struggling with passions that they'd like not to have. And psychotherapy gives us instruments to deal with them in a way that is exactly what Aristotle was talking about when he instructed us as to how to grow in virtue. In fact, Aristotle spoke about how we can have passions, emotions, and desires that we have a hard time controlling. And it's not just an issue of willpower, but it's also an issue of ordering those passions. So there are people who, for instance, would like to have another piece of chocolate cake, which might be a non-desired desire because they're also trying to lose weight. So Aristotle says that the person who has self-control is capable of not having another piece of chocolate cake even though they'd like to. The person who is virtuous, for Aristotle, is actually the person who eats just the right amount of chocolate cake and does so because he enjoys eating just the right amount of chocolate cake. And having another piece that would be too much, he considers too much, so it would just be overfilling and he's not even interested in it. So we can go back to the case of the football field goal kicker and look at what's going on inside his head as he's approaching the playing field. The line of scrimmage is set up and the offensive line is there, and there's the placeholder who's getting ready to receive the snap from the center. And he's got lots going through his head, but what he's trying to do is he's trying to concentrate on the task at hand. He's trying to set aside all of the nerves that are coming into play here. A case that is often dealt with in psychotherapy is that of people who suffer from pathological fear. It's called phobia, like agoraphobia, people who are afraid of going to the market, people who are afraid of being in places with a lot of other people, or people who are afraid of heights, people who are afraid of flying in airplanes. All of these phobias can be pathologies. Now, what CBT indicates to us about pathological cases of phobia, that what these people are really afraid of at heart isn't, for instance, getting into the airplane, flying in the airplane, or it's not going into a public space with a lot of other people, going to a convention, for instance. What they're really afraid of is their own fear. And they're afraid that their own fear could spiral out of control. And so they're afraid of this passion within themselves. And what CBT, of the mindfulness or ACT type of strategy, proposes is that someone who is suffering from phobia ought to, this disordered kind of phobia, ought to address it head on, accept the fact that they have these feelings, renew their commitment, and then do what they should do regardless of that passion that they're having. See, here too we could apply the same strategy to the football kicker, the field goal kicker. What he should do is blot out all of the fans, blot out all of the noise, concentrate on the ball, and concentrate on the uprights in order to kick the field goal and win the game. You should even forget about all the celebrations that will occur after the game. Just concentrate on the ball and the uprights. Concentrate on the task at hand. It's interesting that in contemporary psychology, there's a concept that's been developed a lot recently through various surprising experimentations, which is called selective attention. Selective attention is the trait that we all experience, and it's due to how our brains are put together. And it's especially due to what we could consider two different levels within our brains. There are more primitive components like the thalamus or the limbic regions, and there are more advanced that are specific to humans that no other primates have, like the neocortex. Now, what's going on in selective attention is that there's all kinds of things, all kinds of sensory input that we're receiving all the time that we normally don't even think about, we don't even realize. All that input is coming into our limbic system, and yet it's not getting transferred to the neocortex in order to result in planned strategic action normally. For instance, a lot of us normally wear shoes, and we normally wear socks in our shoes. And socks on our feet and on our ankles cause a certain contact with our skin. that someone might consider uncomfortable. I right now am wearing socks and shoes, but I wasn't thinking at all about it and didn't feel at all that I had socks touching my skin. There's lots of feelings that we have that we may not be attentive to at all. Other feelings that we are attentive to, and they can come in and really affect our behavior. So selective attention is this study that has shown that all of us are affected by an amazingly severe tunnel vision, which actually helps us to perform a lot of the tasks that we perform in our lives, that we can concentrate very closely on certain tasks at hand. But this selective attention, or tunnel vision, can also have dangerous implications. And we see this, for instance, in the case of drug addicts, would be an extreme example of selective attention. A drug addict, let's say a recovering drug addict, and there's a lot of neuroscientific data that's been developed on this recently. A recovering drug addict who is making an effort to not take opiates anymore, heroin, goes to a cafe to meet a friend for lunch, break during work. And they happen to be playing in the music system in the cafe a song that he was listening to when he first had the experience of taking heroin. An experience like that can act as a trigger, so that it rises up from the limbic system. A deep craving could occur in such a person that shoots a message straight to the neocortex, telling him that he wants drugs, and he wants that particular drug. He wants to have that experience that he had before. Now, craving in a recovering drug addict is a non-desired desire. It's a desire that he has that he would like not to have. He'd very much like not to have. And the temptation at that moment is that maybe the most immediate way to get rid of the craving is to get the drug, and then he'll get rid of the craving. But of course, that leads to an even deepening into the vicious spiral of having to get it again, another time. So what does ACT propose to do with this? This kind of a scenario, and I use the extreme one of a recovering drug addict. We could also consider the scenario of somebody who is working in the middle of the afternoon, concentrating on a project that they have to do, and they feel tired, and they'd like to get up and take a break, but they realize, I better stick to it. Well, there's the limbic system communicating to the neocortex. What ACT proposes is mindfulness as a strategy, meaning you accept the craving or the desire. It could be to take a break, it could be to take heroin. You accept it, you look at it, you consider it, which is not to consent to it. Of course, a very different thing is to feel something, and another different from consenting to it. You can feel it without wanting it. So you can feel it, acknowledge that you feel it, and acknowledge that you can deal with it. It's not going to kill you. You can keep feeling it. And then when you make a commitment to do something, to a commitment to a good, as Aristotle would explain it, you light up, and this has been proven through neuroscience, through what's called functional magnetic resonance imaging. The higher part of the brain lights up and takes control. And that's the part of the brain that is involved in decision-making or executive action. And so you've overcome this demand from the trigger mechanism that was arising within the limbic system. And you've overcome it with the neocortex. Through practice, what psychotherapists indicate, one can, little by little, redirect that selective attention in such a way that there will no longer be an imperative command coming from the limbic system. Instead, one's reason will be in control. And this is exactly what Aristotle was talking about when he spoke of virtue, of moral virtue. Selective attention is exemplified in many things in real life. For instance, a colleague, or maybe one's spouse, has a habit or a tic that one doesn't like. And selective attention can make that all of a sudden appear like a big deal, and it's something really annoying. And again, there one can apply ACT, mindfulness, and focus on the good things in one's colleague and one's spouse, while acknowledging that, yeah, that other thing bothers me, but so what? I can deal with it. And I still care for that person, or I still love my spouse in the case of one's spouse. Now, the result of selective attention and these trigger mechanisms or cravings coming up from the limbic system can lead to what's called impulsive behaviors and also compulsive behaviors. The impulse is, I've got to take a break, I've got to get a new dose of the drug. Compulsive is one one ends up in what's called automatic behavior. That the limbic system has triggered the neocortex to seek a plan of action, which is actually rational, and yet it is commanded from the limbic system. So it's coming from the primitive part of the brain, and yet it's being carried out through a practical strategy that is designed by human reason, something that no other animal could strategize about. That's an automatic behavior. It's sometimes called compulsive. Some authors contrast that with mindfulness by calling it mindlessness. So they talk about being mindless and being mindful. And by being mindful, we're giving rational attention to what we should be doing and the goods that we're living for, rather than being dragged around like slaves by our limbic system. In fact, the analogy of slaves is something that Aristotle uses to describe the person who is vicious, who doesn't have moral virtue, but is thrown around by his passions. By applying our reason and ordering our passions, we can act in a way that is reasonable and truly perfective. I mentioned that neuroscience is, through functional magnetic resonance imaging, is presenting us with lots of data that indicate how effective ACT can be. Because we can see different regions of the brain light up, and how by practicing virtue, by practicing rational directing not just our behaviors but our emotions, we can overtake the more primitive parts of our brain that we have in common with monkeys, and actually even reptiles have some of the lower parts of the brain that can ignite in us these deep cravings. So neuroscience explains what's going on in the brain when we suffer from the craving. It also explains what's going on in the brain when we practice Aristotelian virtue by rationally directing our actions. All of this is about human maturity. It's about developing virtue. Of course, for little children, they are totally impulsive in their behaviors, and everything is now, and they can't wait. What's called delayed gratification. Delayed gratification is the capacity for delayed gratification is something to be learned and to be practiced. And of course, it's a rational, high-level activity that adult humans ought to be able to perform. So all of what psychotherapy is proposing for us is also coincides with Aristotelian Thomistic virtue theory. And it explains in part what's going on biologically, chemically, neurologically within our brains as we're developing virtue. It also has implications for the spiritual life. Saint Josemaria Escrivá, the founder of Opus Dei, who's been called by Pope John Paul II, he was called Saint of Ordinary Life. Saint Josemaria Escrivá emphasized how moral perfection, sanctity or sainthood, is achieved by putting yourself into doing what one ought and putting oneself into what they're doing. So this, by really addressing what I have right before me, what I should be doing now, which is loving the good, which is renewing that commitment and doing that commitment out of love, one is achieving virtue not just at a natural level, but even a supernatural level, if the good that one loves is a supernatural good, like God himself. There's another interesting consideration here, which has to do with the effects of original sin in the human being, and how St. Thomas Aquinas analyzes it. St. Thomas Aquinas talks about the fomes of sin, or the fomes peccati, and he considers these to be a punishment that is in human nature due to original sin. And it's a punishment which causes within us a disorder, it's a lack of integrity. In fact, the fomes of sin are caused by original sin is what leads to in all of us the experience of having disordered passions, disordered emotions, disordered desires, disordered feelings. You might ask, well, why did God do this to us? Why did we receive this punishment on account of original sin? And what St. Thomas Aquinas says, following St. Paul, is that the fomes of sin, or this tendency towards disorder in fallen human nature, is a punishment that God inflicted upon us. Of course, not because God wants to get back at us and he wants to hurt us, but because he wants to help us. So it's a medicinal punishment. It's a punishment that's medicine. It's to help us. And therefore, it's salvific. And in fact, every time we experience this disorder, it's a reminder to us that we need a Savior. It's a reminder to us that we need help. And so it's a reminder to us to act exactly in the opposite direction that Adam and Eve acted when they committed the first sin. When they committed the first sin, they were trying to be like God. Now we, human nature, we are made in the image of God. But we're not made to replace him, to take his place. Instead, we're made to aspire to be like him by loving him and ordering our lives according to him. So when we experience this disorder, if we renew our love for God and turn to him and ask him for help in order to overcome this, then he will give us, according to faith, we know that he will give us grace, which is a supernatural help to overcome the defect. But moreover, we will have been practicing ACT, because we will have accepted and acknowledged that we have a disordered desire, or a non-desired desire, which is also disordered. And then we will have renewed our commitment of love, and we'll be doing what we ought to be doing for the sake of charity, which is ordering our whole life towards the good.